Welcome back to everyone's favorite morning talk show, Wake Up for Safety. We just got a report that the turnpike is backed up all the way from Camden to Weehawken. So in other words, traffic is normal today. I'm so honored to be joined by today's special guest, Dr. Soraya Smith, a surgeon from the RWJBarnabas Health system. Dr. Smith, we always like to start with a trivia question sent in by one of our viewers, and today's question comes to us from Dan. Dan says, "This is the part of a car that, with one click, can save both drivers and passengers from harm." Great question.
Seatbelt?
That's correct. And coincidentally, the word seatbelt begins with the letter S. We love the letter S around here because our favorite word, safety, begins with it. Dr. Smith, I know that you're a safety champion as well. Can you speak a little more to that?
Sure I can. In healthcare, safety isn't just a goal. It's also a useful acronym to help us remember the steps we need to take to meet that goal. In the safety acronym, the letter S stands for Speak Up for Safety, and it's where we need to start.
Speaking up can sometimes be hard, especially if you feel like the person you're talking to isn't going to listen.
It can be hard, which is why we need to make sure people know it's not only okay to speak up, but necessary that they do so. At RWJBH, there are a lot of different team members that all work together to keep people safe. And in order to do that, they need to feel like they can speak up about safety concerns. One of the ways we can do this is by recognizing and then reducing power distance.
I'm not sure I've heard that term before. What's power distance?
Power distance is when someone feels like the person they're interacting with has more power than they do. And by power, I mean title, privilege, status, or education. Because in those situations, they are much less likely to voice a concern. When power distance is high, people are also less likely to ask a question and more likely to just do what they're told, even if they know it's wrong. Part of safety culture is having the courage to speak up for safety, even when the power distance is high, as well as encouraging people with high power distance to use their influence to make it safe for others to ask questions.
Dr. Smith, you're a well-respected surgeon with years of experience. How do you help level the power distance team members might feel when interacting with you?
That's a great question. Since I recognize the perceived power I have, I make it a point to intentionally ask for thoughts and reassure my other team members that I want to hear from them. And if they're going to speak up, that means I need to be respectful and listen to what they say. When I'm in the OR before we begin the surgery, I let everyone in the room know that their concerns matter and to please speak up. We're all equals in safety and reliability. If someone does voice a concern, I stop, listen, and respond so that everyone, our patients and team members, can stay safe.
So, if a RWJBH team member observes a situation that they believe compromises safety or reliability of experience for a patient, resident, or employee, they have a responsibility to raise that concern, and lessening the power distance can help with that. How should someone go about raising a concern?
Well, there are two ways. The first way is using ARC, or ARCC, which stands for Ask a Question, Make a Request, Voice a Safety Concern, and use Chain of Resolution. Escalating a concern using ARC is a communication technique that can help assert a concern in a non-threatening way, and can also help escalate the concern progressively if it's not addressed in our initial attempts.
Have you ever used ARC, Dr. Smith? And if so, will you tell us about it?
I definitely have. When I was a resident, my attending physician, Dr. Jones, was going to check on a patient in isolation. Dr. Jones was about to walk into the room without any protective equipment on, and I decided to ask a question by saying, "Dr. Jones, aren't we supposed to put on a gown and gloves when we enter an isolation room?" I thought that maybe he had just forgotten. It had been a long day, and I wanted to give him the benefit of the doubt, but he just replied that he wasn't going to touch anything. Even though I felt a large power distance between us, I knew that I had a responsibility to keep the patient safe. So I knew I had to make a request and ask Dr. Jones to please put on protective equipment before going in the room. He was visibly annoyed and said that he didn't have time for that. I wanted him to know that I thought his and the patient's safety was at stake, and said that I had to voice a safety concern. Dr. Jones, I said, I am concerned about the safety of our patient and other staff. We use barriers to prevent the spread of infections. Well, he ignored me and continued into the patient's room. At this point, I knew I had to use chain of resolution and said, Dr. Jones, I am not comfortable with this. I need to speak with my supervisor. The supervisor agreed that our policies and procedures are in place to keep people safe and instructed Dr. Jones to follow protocol when entering isolation rooms. I know firsthand that it can be hard to speak up and how frustrating it is when we don't feel like our concerns are valid. But with ARC, we're able to be respectfully persistent in getting a resolution to the problem.
Wow, what a great story! You mentioned that there are 2 ways to raise a concern. We now know about ARC. What's the other way?
Oh, right. The second way is to stop the line. Unlike ARC, which is a gradual escalation of concern, stop the line is more immediate. In other words, I can't let them take one step further or else harm will happen and action needs to be taken now. Like in the OR when the surgeon is about to cut into the incorrect limb in surgery. Like discovering that a non-English speaking patient is about to be sent home without translated discharge instructions. Or like seeing someone show aggressive behavior toward a colleague or seeing a colleague be disrespected by someone else.
Wow, those are certainly some good reasons to act fast. Now, Dr. Smith, what's interesting to me is your last example about seeing a colleague disrespected. Usually, when we think of safety, we think primarily of patient safety and physical safety, but you're telling me that there are many reasons to stop the line?
Absolutely. Patient safety is, of course, incredibly important for RWJBH to be a high reliability organization. We need to make sure we can make a stronger connection between all elements of reliability in healthcare. Reducing power distance and creating an environment of psychological safety helps to create a holistic culture of care and respect, and encourages employees to speak up when behaviors are inequitable. Being mindful of cultural differences, roles, and rules when understanding limitations regarding the ability to speak up allows us to step in and assist others when necessary. In that way, we can also stop the line for discrimination and racism. And I have firsthand experience knowing how supportive it feels when your colleagues actively work to shut down racist behavior. Once, I walked into a patient's room the morning of a surgery to ask a few questions. I had met the patient before, and she was always very friendly, but I had never met her husband, who was there that morning. "Good morning, I'm Dr. Soraya Smith, your wife's surgeon," I said, extending my hand. He wouldn't shake my hand. Then said, "You're Dr. Smith? I didn't know you were black. I didn't want a black doctor operating on my wife." Needless to say, it was quite demoralizing in the moment. But luckily, I had a thoughtful nurse with me who spoke up and immediately stopped the line and said, "Our health system honors and respects all the members of our team. Your comment regarding Dr. Smith does not align with our anti-racism values. We cannot move forward until we address this."
I'm so sorry you had to experience that. But I'm thankful that RWJBH has zero tolerance for racism, regardless of the source, and that people are empowered to speak up for safety, whether physical, mental, or emotional. We're just about out of time. Dr. Smith, do you have any last thoughts to share?
Speaking up for safety is a two-part process. We need to be empowered to speak up when we have concerns, and we also need to listen when those concerns are raised to us. And although concern regarding patient safety is a very important component to being a high reliability organization, we also have to listen and respond to other concerns, our own safety, colleague safety, or patient's experience. By using tools like ARC and Stop the Line, we can be sure that our concerns will be heard and addressed, and we can play a major role in stopping harm to our patients and each other.
That's all for today's episode of Wake Up for Safety. Tune in next time when we explore more letters in our safety acronym and have a great time doing it.
The coffee is strong, the sun is getting high. Let's wake up for SAFETY.
You can't spell safety without S. You might even say it's an essential letter. And S is also the foundation of our Safety Together acronym, SAFETY, reminding us to always speak up for safety.